Bay Medical is now part of Sacred Heart's 5-star family of hospitals, where you can expect to receive the very highest level of care. In fact, Bay Medical Sacred Heart has been recognized as one of America's 50 best hospitals for the past 5 years in a row. In HealthGrade's review of more than 130 million medical records from more than 5,000 hospitals across the country, they found that if all patients had been treated at a top-rated hospital like Bay Medical Sacred Heart, that mortality would have been reduced by 27%, and major complications would have been 8% less likely.
HealthGrade's reviews over 22 conditions and procedures. So you really have to be focused on this hospital-wide. So they look at things like our heart program, our critical care, our surgical services, women's and children's, general medical care, as well as the emergency department overall. So you truly have to have that consistent focus on quality consistently every day. That's truly something to be proud of, but really the credit really is attributed to our excellent physicians and nurses and other clinical staff, and it's really evident that they're truly focused on patient-centered excellence.
Bay Medical Sacred Heart is probably best known for its award-winning heart program, with 5 cardiac catheterization labs and the area's only open-heart surgery program. Bay Medical Sacred Heart is prepared for any heart emergency. Heart disease is still our nation's #1 killer. With an intense focus on excellence, Bay Medical Sacred Heart's cardiac cath labs have a less than 1% mortality rate, a rate that is far below the national average.
I think this is an outstanding heart team. They know how to get patients quickly and efficiently to the cath lab in times of heart attack because they know time is tissue and we got to open up the vessel as quickly and efficiently as possible. With regard to the elective cases, they spend extra time answering all questions, putting the patients and their families at ease so that all patients feel comfortable when they come here. And in general, it's just a happy place to work. They know that they're part of a winning team. Saving lives makes the people who work here really happy. I'm proud to be part of it.
The heart program at Bay Medical Sacred Heart also offers many more advanced procedures you wouldn't expect to find in a community this size.
BayMed has invested in technologies that normally you can only find in a university setting. So for example, in congenital heart defects that historically had to be opened up with open surgical procedure, we could perform them right here in the cath lab with the equipment that the institution has invested in. Additionally, we could put in percutaneous pumps or work on the carotids and things that traditionally were unable to be performed in the cath lab setting of this sort. Additionally, in terms of treating arrhythmias, this is the only place between Tallahassee and Pensacola where this could be treated with the equipment at hand by qualified electrophysiologists.
Thanks to advances in technology, many heart issues can be repaired in the cath lab. However, when surgery is necessary, Bay Medical Sacred Heart has a team on standby for emergencies. Bay Medical Sacred Heart is the only area hospital offering open heart surgery, which gives heart patients added assurance should their condition become more serious. However, even in the operating room, new technologies are helping patients.
We do have obviously traditional open heart surgery here at Bay Medical Center, have had since the 1980s. But as time goes forward, we're developing newer techniques. The hospital has acquired newer equipment, most recently the robot, of course. We're using it more and more on a regular basis now, doing non-cardiac surgery, thoracic surgery, removing lung tumors and so forth, and are in the process of developing using the robot for open heart surgery as well, most notably mitral valve surgery. Not everybody will be a candidate, but for those patients that are, we hope to have that technology and techniques available.
Bay Medical Sacred Heart has always worked to bring the best to our community. In 2010, Bay Medical Sacred Heart opened a new state-of-the-art patient care tower with new private patient rooms. Now, with Sacred Heart and LHP, Bay Medical Sacred Heart continues to grow and improve with renovations to transform the previous hospital main entrance to an updated women and children's pavilion. Once complete, this area will have a new look and expanded capacity to meet the needs of our growing community. Bay Medical Sacred Heart has also risen to the challenge of another community need by becoming the area's first and only state-designated trauma center, serving Bay, Gulf, Washington, and Holmes counties. To qualify for this designation, the hospital must have trauma surgeons, neurosurgeons, and multiple other surgical and medical specialists available within 30 minutes at all times. Trauma centers have all the necessary equipment and the protocols in place to care for trauma patients from the time they enter the ER to surgery, intensive care, rehabilitation, and recovery.
The state of Florida has a very rigorous set of rules and regulations that apply to trauma centers and becoming a designated trauma center. It's a very laborious process, a very arduous process. It took over 3 years for us to achieve this. The average is about 4 years actually to get the designation based on the difficulty and the number of things that you have to look at, have to collect data on, have to achieve, have to redefine, remodel in order to get the designation.
Trauma centers provide the fastest and the best quality care in the most efficient and cost-effective setting. In fact, a recent study revealed that preventable trauma-related deaths could be reduced as much as 20% when the most critical patients are treated at trauma centers.
You know, it's a risky world, and we're in a risky area. Folks come here for their vacations. Folks come here and kind of do more high-risk things on vacation and are visiting the beach and the paradise we live in than they do at home sometimes. So that means we are going to see, unfortunately, people that get injured. So I think we're better prepared to take care of those folks, better prepared to take care of me if I had an automobile accident this afternoon, better prepared to take care of the community.
Healthcare is changing, but the need to have the right care right here in our community isn't. You can count on Bay Medical's Sacred Heart to be here with the quality, the technology, and the compassion that makes a community hospital one of America's 50 best.